Welcome everybody to the online program for the SCHC alumni, and we've been talking about the idea that we can learn something from research on how therapy helps people. And last week we talked about this idea of we could sort of gauge if there's been a big change in therapy based on these components of personality. And this is a very big one in the addiction field, of course, as Dr. William Silkworth in the Big Book says, recovery demands an entire psychic change. And a very famous researcher by the name of William Miller conducted a study with Janet Subaka on what he called quantum change, a radical change. Now, not all of them were alcoholics, but there were lots in there that were, and that what happened to those people, according to Miller, is that they changed their values. They changed what was important to them. Like before, if wealth was important to them and being respected was important to them, after this change, it was more things like being at peace with themselves, family increased in importance, things like that. Anyway, so that's the personality change thing. By far, the biggest way of gauging whether therapy works is looking at what's called behavioral change. So what behaviors do people change, right? The most obvious one in the addiction field, of course, is do they quit the drugs and alcohol, right? So that's the biggest behavioral change people look at. And of course, the public, this is how they gauge the success of therapy, and families gauge the success for their loved ones, is does the person actually stop using the drugs, right? Including alcohol. But the researchers actually are interested in much more than simply the behavior of drug use. And in fact, even with the drug use, they're actually interested, they want to know if you stopped using them, but they also want to know if you did use them, what did you use, how often, and the big point being, was there a reduction in the drug use after treatment versus before treatment? And usually they give a little test that say, like, in the last year before you entered treatment, how many days a month would you use drugs? And then they'll say, after treatment, how many days a month would you use drugs? And then they compare the two. And if there's a statistically significant difference, then they know they've got something. Hopefully for the better, by the way. So drug use is only one way of looking at this behavioral change. And the researchers are interested in a whole bunch of other things, right? For example, they're interested in, well, what do you do in your daily activities? Are you staying out of the bar? Like, are you hanging around people who are using every day? And they're interested in things like that, the environmental things, like what do you do? What behavior do you accomplish in your daily life? Maybe it's even going to how many 12-step meetings you're going to, or self-help meetings. Are you going to smart recovery? Things like that they'd be very interested in. They're also interested in things like relationships. Like, what are you doing in your relationship? Is the relationship getting better? Is it getting worse? All of these kinds of behaviors they'll also be interested in. And they'll be interested in if there's a change from before treatment to after treatment on, for example, the ability to go to work every day or to go to school if you're a student, right? And they want to measure what it was like before treatment versus what it was like after treatment to see if treatment actually had an effect that was helpful to recovery. And then in the United States, of course, they're interested in, are you getting into any more problems with the law before versus after? So these behavioral changes are quite interesting for a lot of us to help us understand what therapy does to help people conduct themselves in this, in hopefully a way that will help them, as opposed to the old way, which ended them up in treatment. So this behavioral change is, as I mentioned before, it's by far probably the favorite, and it's very easy to measure too. Maybe that's why it's the favorite. But what we're looking for is, if there is a change, then there's probably something about the therapy that helped that person make that change. Not so much interested in what specifically is in the therapy part, but what is it, what behaviors does therapy affect? At any rate, that's it for this week, and we'll be back next week with number 3 in our little topic here.